Yesterday, President Muhammadu Buhari and Vice President Professor Yemi Osinbajo received their vaccinations on live television. The exercise was preceded by an e-registration of the President and his deputy and a presentation of their e-vaccination cards after the jab. Joining us now to speak on the vaccination rollout is Dr. MUHKTAR Mohammed, Acting National Coordinator, Presidential Task Force on COVID-19. Dr. MUHKTAR Mohammed, thank you very much for joining us.
Thank you for having me, Ruben. It's a pleasure.
Thank you very much indeed. Well, Dr. MUHKTAR Mohammed, you were the incident manager of the rollout of the COVID-19 program in Nigeria, and now you are the Acting National Coordinator. What we have been told is that Nigeria is prepared and that everything is in place. How prepared are we in terms of the rollout? We have seen the ceremony on Friday. We have seen the vaccination of the President and the Vice President on Saturday. But how prepared are we, really, for a national rollout?
So thank you very much, Ruben, for having me on this program. It's really our pleasure and really gratitude that we have come to this far on the program. It's a little breaking out, yeah. But let me just continue. Yeah, so how prepared are we? As a country, we have come a long way trying to prepare for the arrival of these vaccines. The Federal Ministry of Health, as well as the National Primary Healthcare Development Agency, have worked hard in the last few days to ensure that these vaccines arrive the country. There is so much negotiation that went before this vaccine arrived. There were several meetings with international partners, as you mentioned, the WHO and the COVAX facility. We had bilateral meetings and negotiations also with the countries and manufacturers. And really, it is the culmination of all this effort that we had this vaccine on Friday. And the epic moment yesterday, where the President received and the Vice President received their jabs, is really a very exciting moment for the country. In terms of preparedness, our agencies, the Federal Ministry of Health and the National Primary Development Agency, are well prepared. They have put in the logistics in place in terms of receiving the cold chain facility, in terms of recruitment and training of staff, and in terms of deployment to take these vaccines to the hinterland to ensure that all people who are made to receive these vaccines receive them in the coming days.
Well, Dr. Mohammed, one of the issues we had during the week was the Presidential Task Force and the MPHCDA saying that states that are not prepared in terms of storage facilities, cold storage facilities, may have issues with this national immunization rollout. What is the level of engagement with the states? And what can you tell us in terms of preparedness at the level of the states and the local governments?
So in terms of state preparation, we are aware that most of the states are ready. The few ones that are not ready have a checklist for them to comply to ensure that their central stores are utilized. The number of cold boxes are adequate in terms of short-term storage. And also in terms of training, the central training has been conducted. The states have also conducted their step-down training. Maps of the facilities have been done. And most of the states, I will tell you, only a few perhaps are trying to fulfill this criteria. But as far as we are concerned, from the PTF side, we know that the Federal Ministry of Health and the National Primary Healthcare Development Agency have given us assurance that most of the states are ready and rollout is going to start as soon as possible.
Well, Dr. Mohammed, one major concern among Nigerians is whether or not the rollout will be fair. During the COVID-19 palliatives, rollout, as we had it, some states that were not even the serious centers of COVID-19, they got more than the epicenters, as it were, if I may use that word, of COVID-19. What is the guarantee that there will be fairness this time around? And there are states that do not even believe that they have cases of infection will be the ones who will collect these vaccine doses and then go and store them in their warehouses. And the states that really need the vaccines will be the ones that would be ignored. But we'll take a short break. Dr. MUHKTAR MOHAMMED, Acting National Coordinator of the Vaccine Rollout, Presidential Task Force on COVID-19, and we'll be right back with you. Please stay with us. Welcome back to This Day Live, the Sunday talk show here on the Arise News channel. And our guest is still Dr. MUHKTAR MOHAMMED, Acting National Coordinator, Presidential Task Force on COVID-19. Dr. Mohammed, thank you very much for staying with us. Well, I mean, we went on that break, but I would like to ask you, what are you doing? What is the Presidential Task Force doing to address the issue of vaccine hesitancy? Many Nigerians, despite all efforts, still do not believe that COVID-19 exists. We saw the president and the vice president taking the vaccine yesterday, but some people still think, look, these people, they are just doing this to make money for themselves, for the agencies. So what are you doing to make sure that Nigerians believe that COVID-19 really exists and that they listen more, they follow the science rather than the pastors?
Well, certainly, we're trying to engage the various stakeholders, the various sectors of the society to try to speak to all opinion leaders, religious leaders, as well as political leaders. We're in constant discussion with the state governors regarding the equity you mentioned earlier on and the distribution of the vaccines. And I can assure you that the state governors are very eager to receive the vaccines. They are also eager to provide logistic support where necessary to ensure that eligible people are not left out in their states. The PTF has actively engaged our religious and traditional leaders because we know that without engaging them, we may not be able to fulfill all the necessary obligation on our part to make sure that every sector of the society is engaged. The religious leaders have a very prominent role. The PTF is engaging with the Supreme Council for Islamic Affairs as well as the Christian Association of Nigeria to ensure that they sensitize the people. They use the pulpit, they use their religious gatherings to enlighten the people and provide the correct information and the facts out to people regarding the vaccine. We're aware that there are a lot of conspiracy theories out there in the field. People can go on the internet and get all sorts of information, not only from Nigeria, but from other climes as well. So we have dedicated groups that are trying to work to provide the correct answers. For example, when people talk about the safety of the vaccine, we can assure you that locally here in Nigeria, NAFDAC has checked the safety of the vaccine. They looked at the documents from the manufacturers even before the vaccines arrived. And when the vaccines arrived, NAFDAC took samples of the different batches of the vaccine and tested them to ensure that what is mentioned in the document is actually what is found in the vaccines. And they also checked for other elements, including the solvents or the some of the chemicals that are used as diluents. So they have also confirmed to us that there is nothing extraordinary, there is nothing that is harmful the vaccine is safe for everybody's use. We know that after the administration of the vaccine, we can have a few people who can develop some of the side effects. These side effects are known, and the symptoms are not different from the symptoms of the disease itself, which would include fever, small rash, or having cough or cold, which will last just a few hours or a few days, and then it will go away. And then still we know, because of the efficacy of the vaccine, still some people may take the vaccine and they may still come down with the disease. So let's bear that in mind. When we start having these cases, let us know that it is a normal process, that it is expected, it is scientifically established that the vaccine is efficacious. And when a vaccine has an efficacy of about 80%, it means 2 out of 10 of every people you vaccinated are likely they can come down with the disease. So when this happens, let it not be said that, oh, they have taken the vaccine and now they have come down with the disease. We know that that is going to happen.
Well, Dr. Mohammed, you recall that this same AstraZeneca vaccine that Nigeria has accepted, gratefully from the COVAX facility, was rejected in South Africa. And there are Nigerians who are saying, okay, why have we accepted what South Africa rejected? South Africa decided to go for the Johnson & Johnson vaccine. And yet, we've also been told that there are variants of the virus that have been reported in Nigeria. Can you please, for the benefit of those Nigerians who have these doubts, explain why the AstraZeneca vaccine is a best option for Nigeria?
Yeah, thank you very much. That is very brilliant question and quite pertinent. Yes, it is true that South Africa rejected the Oxford AstraZeneca vaccine after a small study that they conducted because of the variants or the mutants that are circulated in South Africa. Now, the specific mutant that is circulating in South Africa has not been found in Nigeria yet. What we have are the variants from the United Kingdom, which this vaccine has been shown to be quite effective against. For the variant in South Africa, they say it is about 50% or less. Therefore, we cannot be using Oxford AstraZeneca in Nigeria if we had detected the South African variant to a large extent in this country. As far as we know, we have been taking random samples of passengers who have arrived in Nigeria from the United Kingdom and also from South Africa. Whereas we found about 27 variants of the UK strain, we have not found a single variant yet of the South Africa strain. And that really made us to agree, to use the Oxford AstraZeneca, because for now, we don't have that strain. And we are putting stringent measures on our own part to ensure that passengers who are arriving from the United Kingdom and also from South Africa go and undergo an extra scrutiny. They have to do the mandatory quarantine under observation, and we have to take their samples also for testing as well.
Well, Dr. Mohammed, you have been talking about what is called TEACH, T-E-A-C-H, in terms of strategy or approach, if you like. I would like you to take us through that. My concern about that strategy is the fact that you were talking about, or your department was talking about an e-strategy, and there is e-register. Now, that register, within 24 hours, we were told that about 2.3 million Nigerians signed up to the vaccination program. And all we have is just 3.9 million doses of the vaccine. And one state in the southeast is even saying they need up to about 3 million. How do you manage that? And then there's also, on the other hand, the four-phase strategy approach. And then the focus is on persons between the ages of 18 to 64. I think, many of our viewers, many of our listeners, many Nigerians who are concerned in this matter would like to know what is this strategy all about? What informs it? How did you arrive at the age bracket resolution? How did you arrive? How are you managing the e-register portal? But before we come to that, we'll take a short commercial break and then we'll come back to you. Please stay with us, Dr. Mohammed. Our guest is still Dr. MUHKTAR MOHAMMED, former incident manager of the Presidential Task Force on COVID-19, and is also, at this moment, the acting national coordinator of the Presidential Task Force on COVID-19. Dr. Mohammed, thank you very much for staying with us. Well, Dr. Mohammed, we were talking about how to ensure equity and how to ensure that this program, this immunization rollout, goes on very well. But I'd like to ask you another question. Equity, how do we ensure that? Some of the state governments, they're worried about this. How do we ensure that there's equity in terms of the rollout and that we do not have a situation whereby certain classes are left out and that we do not have a situation whereby out of the 2.3 million that we have now, 3.9 million that we have now, that certain people are left out of this rollout?
So thank you, Ruben, for that question. And I think it has been a major source of concern. But our technical teams in the National Primary Healthcare Development Agency have articulated a very equitable process for distribution of the vaccines. So I'm glad you mentioned equity and not equality. Equity is to provide those who need the vaccines first, or those who have the risk of having higher mortality to make sure that they have the vaccines first before others. So for now, our most important priority is to ensure that our frontline healthcare workers are vaccinated. And for the next few weeks, this will be the target population that will be vaccinated in the country. This will include our workers who are working at the border posts, who come into interaction, with foreign travelers who may be carriers of the disease. It will include hospital healthcare workers, particularly those working in isolation facilities, then followed by those working in emergencies, and then other medical healthcare workers. And it will include all categories of healthcare workers, doctors, nurses, lab scientists, physiotherapists, pharmacists, and all other healthcare workers who come into interaction with patients. Because the natural thing is when people are sick, the first point of call they go to the hospital. So you can imagine if someone is down with symptoms of COVID-19 and he goes to the hospital, the unsuspecting healthcare attendant, including the cleaners or the sub-staff, attend to this person. So they are at a higher risk of getting the infection. So they are our front line. And if they go down, then certainly our response will also go down completely. And that is why we have prioritized the healthcare workers. This is regardless of their location. It will be in every part of the country. And equity also talks about the states or the places where the disease has a higher burden. So certainly we have seen consistently that Lagos has the highest burden. Lagos has borne the brunt more than any other state of COVID-19 in the country, and therefore proportionately Lagos will be deliberately targeted to ensure that they have been prioritized and the healthcare staff are attended to, followed by FCT, Plateau, and other states as we have seen in the epidemic. Next, following the healthcare workers, are the elderly people who probably have an additional risk factor, such as obesity or diabetes. So people above the age of 60 who have comorbidities will then be identified and vaccinated. And as you mentioned, the TEACH strategy simply is looking at all the options available for us to reach out to everyone, to ensure that everyone has equal access to vaccination. So it is talking about the traditional method of immunization, where we do it through the fixed post. People go to primary healthcare facility and they receive their vaccination. We're also talking about the new technology now, which is using electronic enrollment. People can do this self-registration as long as you have a mobile phone that is internet enabled. You can go ahead and register yourself and choose the location where you need to be vaccinated. The third strategy is talking about an enhanced enrollment, which means that the healthcare workers will assist you to enroll you in your presence, using the available technology. And of course, we also talk about the community strategy, where they will now do house-to-house vaccination to ensure that everyone has equal access. Now, the point I would like to make here is that the doses received now are so few. 4 million for about 200 million, that is really not enough. So the 4 million are dedicated for now, prioritized to healthcare workers, particularly our frontline healthcare workers. I believe that these are the population that will exhaust these numbers. But it's also good to know that we are also expecting additional about 18 million doses very soon in the next few weeks in the country. And that is when we start doing for the general public. There is no need to rush or to shunt the line or to try to take all the vaccines to yourself or to your household because you are in a position to do that. There will be enough vaccines for everyone in this country. And the approach we are taking is to ensure that we follow this prioritization as our healthcare workers are priority, and then people with comorbidities are also at an increased risk of mortality. So please, Nigerians should bear with the processes. We know that there are bound to be glitches with internet, as you mentioned rightly, about 2.3 million people registered within the first 48 hours. And they had some glitches on the internet. Now we have a dedicated team that is working to make sure that these glitches are fixed.
There have been issues, complaints about the e-register platform. Some persons have gone on social media to say that they are asked questions about, okay, what is your age? Do you qualify? And persons within the age range of about 50, 55 have been told that they do not qualify to register on the e-register platform. What is responsible for that error? Because the same MPHCDA and the PTF reported that persons between 18 and 64 are qualified, but persons have gone onto that e-register platform and they are told that they do not qualify. What is responsible for that? Do you have an explanation?
Yeah, so like I said, some glitches are bound to happen when you have hundreds or thousands of people trying to use an internet platform all at the same time. We know what happens. Sometimes the website can crash, it can be slow, and therefore you may not get the feedback immediately. It would appear to you as if you are not being allowed to make progress. But as far as I am aware, everyone is eligible to register. Registration does not mean getting the vaccine. Registration means you have secured yourself a place of time and location where you will get your vaccination. So everyone above the age of 18, and we have a reason why we are not vaccinating people also below the age of 18, but everyone above the age of 18 should be able to go online and secure that place for himself. If there are issues, I believe there are individual issues and they will be sorted out by our technical team.
Dr. Mohammed, we have 3.9 million doses. When will the next consignment arrive? And is the Nigerian government making any effort to get, vaccine doses on its own account instead of depending on charity or philanthropy? Because what is coming from China, from India, from the AVAT, African Union Initiative, and the COVAX facility, this is just basically charity. When is the government of Nigeria going to make an independent effort to see that it achieves the 70% herd immunity that we have been told is achievable in 2022?
Yeah, thank you, Ruben. Certainly, the government is making enough effort. As you are aware, the account has been provided by the central bank, which is also linked to the Afrexim Bank, where monies are being deposited by the Nigerian government and also by individuals who wish to contribute to that amount. It is important that we secure a single line and reliable source. What is happening globally now is, there is this vaccine nationalism, but also there are opportunists who are trying to use, this scarcity of vaccine to try to trade in maybe fake products, to try to bring them through the back door. So we are all sensitized, and all agencies of government have their hands on deck, trying to make sure that we don't deal with such things. Therefore, Nigeria has decided to use a single source, which is through the central bank, with linkage to Afrexim Bank, to make any payment to any manufacturer for these vaccines. You are right, the COVAX facility is being championed by Gavi, WHO, and the other vaccine alliance partners to try to ensure equity of vaccines to developing countries. So,
well, Dr. Mohammed, quickly, we have just about
that is the focus, yes.
We have just about 3 minutes to go. I'd like to ask you about alternatives that Nigeria has been considering. We're told that there is now an alternative medicine, alternative vaccine, if you like, or rather, herbal medicine in Nigeria, backed by the Ooni of Ife. What is the position of the Presidential Task Force on that? Quickly.
Yeah, so for Presidential Task Force, yes, we are looking at alternatives in terms of the vaccines. There are other vaccines that have been given the emergency certification for use by WHO. You talked about Johnson & Johnson. We are looking forward to that. We're also looking at the other vaccines, such as the Russian vaccine also. I know the Ministry of Health is in serious discussion to get that vaccine into the country. But regarding alternative remedies or herbal remedies, there is a standard operating procedure established by the Federal Ministry of Health that if you have any medication, it has to undergo through certain processes to verify its safety, to verify its efficacy, and it's a very known and open book that every new product has to go through. So our research agencies, I believe the Nigeria Institute of Medical Research and the Nigeria Institute of Pharmaceutical Research and Development are up to the task once these products are provided to them.
Well, thank you very much, Dr. MUHKTAR Mohammed, for joining us on This Day Live, the Sunday talk show. And thank you for your insights with regard to the national immunization rollout in Nigeria with regard to COVID-19.